Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is June 26, 2020. As always, we start off with our COVID-19 statistics. Worldwide, we have more than 9.8 million cases. That number is expected to go above 10 million before the weekend is through, probably by tomorrow, maybe at the latest by Sunday. There are also nearly 500,000 deaths. In the United States, there are over 2.5 million cases and over 127,000 deaths. This week was not good for COVID-19 news. We got a lot of bad news, unfortunately. The week started with the World Health Organization announcing the highest single-day increase of COVID-19 cases across the world. And then throughout the week in the United States, several states, including Florida, Texas, and California, just to name a few, announced their own record single-day increases in number of cases, as well as the United States in general has set records for the same thing multiple times throughout the week. The CDC also estimates now that the true number of cases of COVID-19 are about 10 times the number of confirmed cases. So right now we have about 2.5 million confirmed cases in the United States. The CDC estimates that the actual cases are probably between 20 to 30 million. Most people do not show symptoms, so they're asymptomatic. So anyone could possibly be infected and transmit it to anyone else. That's why face masks, social distancing, washing hands, all of that is extremely important for everyone, regardless of whether you're feeling sick or not. In other bad news, a study shows that the antibodies to COVID-19 decrease dramatically after 2 to 3 months after you were infected. Usually, the higher the number of antibodies, the better chance you have at being immune to a certain disease. We don't know if this is how it works with COVID-19, but since that is the most likely scenario, this is bad news, for any vaccines or natural immunity. Basically, what could happen is it could end up being similar to the flu vaccine, where you have to have it every year or possibly even more than once a year if that immunity drops off too quickly. Again, this is all speculation. We don't even know yet if having antibodies makes you immune to COVID-19, but we do need to have more testing done. Testing is extremely important in order for us to find out more about this and to actually get a vaccine that works. Also, also on the bad news spectrum here, the number of recovered cases is usually reported on most websites, a lot of newscasts. The number of recovered is going up, and that's a good thing. But unfortunately, that number of recovered may not be quite as good as we think it is. Some jurisdictions, some state, county, or country health departments are actually reporting people as recovered, even if they're not completely healthy yet. For example, in some areas, and in fact many areas, people are counted as recovered if they have not died and it's been at least 21 days since they first were infected by COVID-19. So with that being said, in 21 days, oftentimes people who are hospitalized will end up staying in the hospital for 30 days or more. And so you could have someone that's counted as being recovered, but they're still in the hospital on a ventilator fighting for their life. You could also have someone that never did go to the hospital or went to the hospital and was released, and they're at home now, but they are still having the difficulty breathing or painful walking or other symptoms and side effects of having COVID-19. So while it's good to cheer for the recovered cases, we do need to make sure that we're careful about that number. We here at Plain English Public Health don't want to make anyone depressed or scared with this information, but we do feel that we need to get the news out and warn everybody about how important it is that we do follow the CDC guidelines. Even if we're in a place that is already reopening, even if we don't feel sick, no matter what, we need to follow the CDC guidelines. We're seeing a resurgence throughout the United States and in other countries around the world The United States seems to have the worst problem with it right now, though, as far as an increase in the number of cases through nearly all states. Most experts now are saying that this is not the second wave. It's actually just a continuance of the first wave. We just didn't do a good enough job of knocking the virus down enough to get it to go away, and so we just started opening up too soon, and things, the virus started coming back. So we need to continue to follow those guidelines. Speaking of the CDC guidelines, we've talked on this program before about the importance of using hand sanitizer when you're not able to wash your hands with soap and water. That's still very important to do, but the FDA did release a warning this last week about specific brands of hand sanitizer. These specific brands of hand sanitizer use methanol in place of or in addition to the ethanol or isopropyl alcohol that you normally find in a hand sanitizer. Methanol is very toxic to humans. It can cause a number of symptoms, including nausea, permanent blindness, seizures, even death. So we definitely do not want to use anything with methanol in it. Those brands that we want to avoid are All Clean, Esk Biochem, Clean Care No Germ Advanced, Lavar 70, The Good Gel, and Saniderm Advanced. For more details, including specific product numbers, please see the link in the description below the video. The FDA has also issued recalls and warnings for a number of salads. If you have any of these salads, please either take them back to the store for a refund or just throw them away. Those salads are the Aldi Little Salad Bar Garden Salad, the Hy-Vee Garden Salad, Signature Farms Garden Salad, and the Fresh Expressed Southwest Chopped Salad Kit. The CDC has also announced an investigation into an outbreak of Salmonella infections throughout the United States due to raising poultry in people's backyards. In order to reduce the risk of transmitting Salmonella, certain precautions need to be taken by anyone raising chickens, ducks, or any other poultry. Those precautions include wash hands frequently, collect eggs often, throw away any cracked eggs, clean dirty eggs with a brush or a cloth. Do not wash fresh eggs that are still warm with water. You need to wait until they are cooled. Don't hug or kiss poultry. Do not bring shoes worn around poultry into the house, and do not bring the poultry into the house. So to finish up the report for this week, we're going to talk a little bit more about face masks. I know we've talked a lot about this in the past, but a lot of people are still wondering about face masks and exercising. When you're exercising, should you be wearing a face mask if you're out in public? Well, the best thing is to just follow social distancing recommendations, and then you probably would not need to wear a face mask. For example, if you were just exercising in your own home, or if you were out jogging on a little used trail that you pretty much never meet anyone, or if you do, there's enough space where you can stay 6 feet apart from them, or if you go to the gym when it's pretty much dead, no one's around, middle of the night or something like that, depending on your area and your gym, then you may not need to use a mask. That being said, anytime that you may be within 6 feet of somebody, you do need to have a mask. You can either wear it all the time, especially if you're going to be within 6 feet of people regularly, or if say for example in the example earlier about the being on a trail that not many people go on, where you may meet a few people here and there, you can just take a mask along and then put it on when you need to. Because of increased breathing during exercising, meaning there's more chance of you breathing out, virus particles, or possibly breathing them in also, since you're breathing harder. It's essential that we follow the social distancing guidelines as much as possible. When that's not possible, then here's some things to keep in mind about exercising with a mask. Recent studies have shown that wearing a mask while exercising can increase a person's heart rate and make the breathing more difficult. However, unless a person either has heart or lung conditions, is very out of shape, like an obese individual, or unless they're doing strenuous exercise. Usually having a face mask will not hamper their ability to exercise enough where it would become a major concern. If the exercise continues for an extended period of time, say 15, 20, 30 minutes or longer, oftentimes, depending on the level of activity, the mask may become wet or just damp possibly, but basically the wetter the mask, the less effective it is. So any of the paper type surgical masks should just be avoided completely because they get wet very quickly and they lose their ability to help at all. Cloth masks can also get wet fairly quickly depending on the material. A breathable synthetic fabric would be your best bet to avoid it getting wet while still enabling you to breathe through that mask and to receive the protection that you need. That being said, even those types of masks, after about half an hour, will still get damp enough that there will be problems with being effective as far as protecting you or protecting others from your breath. So what's recommended is if you are going to be exercising for longer than half an hour around people, within the 6-foot distance, you definitely should be bringing multiple masks. Just make sure that you are taking them on and off properly and disposing or packing them away appropriately to avoid spreading any of the COVID-19 or any other diseases for that matter. In short, wearing a mask while exercising is probably okay. In fact, it's recommended if you're going to be closer than 6 feet to anyone during the time you're exercising. But what's even more preferred is just to stay home and exercise or go somewhere where people won't be around you and just keep social distancing. That is the absolute best recommendation for exercising. Thank you for watching this week's Public Health Report. I'm Richard Greenland, and you have a nice weekend.